Hello, everybody. Welcome to my Facebook Live. Sorry about the delay today, and sorry about not being here last week. Hope you guys didn't miss me too much. Today, we're switching gears. For the last few weeks, we were going over some knee stuff. We went over knee anatomy and various different knee conditions, and if you're interested in looking at those, all the videos are available on my Facebook as well as on our website, fxregencenter.com. Prior to that, we were going over the low back, and we're returning to the spine this month as we start talking about the neck. The neck is something that's really important. Why? Because it holds on your noggin. So there's a lot of stuff that goes on with the neck, and if you're human, you've probably had neck pain in one way, shape, or form at one point in your life, and if you haven't, you probably will. Neck pain is very, very common, and after low back pain, it's the second most common thing that occurs in the spine. And there's a lot of varieties of things that can occur from the neck. Everything from neck pain going into the head and causing headaches, pain in the neck itself, pain into the shoulders from the neck or down the arms. Neck conditions can cause a lot of symptoms. In fact, neck conditions can actually cause symptoms into the legs. There's a lot of structures that are of real importance in the neck, and there are a variety of ways of injuring the neck. Anything from whiplash and car accidents to concussions can cause neck issues. Head injuries can cause neck issues. Even arthritis or degenerative changes over time. And one of the most common things that we're seeing more and more of now are neck issues that are associated with posture. We've always had, and by we I mean humans, have always had an issue with posture over the years, whether it was reading or whether it was sitting on computers or sitting in front of a TV or sitting in our car. Things that hunch ourselves forward. Our forward neck posture has become a part of human nature for all intents and purposes. But over the last several years, I think that neck issues have progressed even more so because we have this wonderful device called the cell phone. And when we are looking down at our cell phone, as we oftentimes do, this can cause a lot of issues in the neck, particularly as we do so over the years. So a lot of stuff to go on with the neck, and quite frankly, we might not be able to finish covering it all within a month because there are a lot of different conditions involved with the neck that I do want to cover. If there are specific things that you want me to address in future Facebook Lives, please comment or DM or email us at info@fxregencenter.com, and we'll definitely try to address as many things as possible from what you guys suggest. But first and foremost, to understand potential issues in the neck, we have to understand the neck anatomy. So I'm going to go over several things regarding neck anatomy, but first and foremost, I have to start at the basics. At one point we're going to go over some of these actual X-rays and MRIs, but ultimately I want to be able to go over the basic anatomy first, because I do think it's super important for you all to know the anatomy, know what's normal, and then know what's quote unquote abnormal. So this is an X-ray of the neck, and I'll also show you kind of what a model of what the neck looks like here. And you know what, we'll start with this first because I think that it's important to kind of see this a little bit dynamically. So this is a model of the neck, and there's obviously a lot of things present on this model, but there's also a lot of things missing. I'm going to go through a little bit of the anatomy one step at a time. And by the way, if you haven't already looked at the anatomy lectures that I gave regarding the low back, I do recommend looking at those because a lot of the anatomy there is applicable to the anatomy of the neck as well. So when we look at the neck here, the neck is comprised of 7 vertebral bodies or bones or vertebral segments, and those contain various different parts. So these rectangles or squares here are what are called the vertebral bodies. In between are the discs. In the back, these spikes that we see here are what are called the spinous processes. Those are the nubbins that you feel when you press the back of the neck. On the side, on either side, you have what are called the facet joints, which is where one bone meets another bone. And that's where motion takes place. And in between those joints and the disc in the front are the holes where the nerves exit. And these nerves exit out of these holes and go down the arms in different distributions. Those nerves themselves come from this central canal, which contains the spinal cord. Now, unlike our discussion with the low back, the spinal cord actually ends around L1, L2 in the low back, so the remainder of the lumbar spine actually does not contain spinal cord in it, it just contains the nerve roots that exit and go down the legs. As far as the neck is concerned, this central canal contains the spinal cord the whole way. So I've used before the analogy of a coffee mug when it comes to the vertebral bodies of the low back, and the same analogy kind of holds true with the neck as well. So when we look at this, now this x-ray here, over here is the front of the body, over here is the back of the body, here's the top, here's the bottom. Right here is our jaw, wherein our mouth would be over here with our esophagus going down. And then our brain would be up off the screen above this area here. And when we look at this, I'm going to start outlining some of the different parts of the spine here. Here you have the vertebral bodies, or the bones, as we mentioned. In between, we have these discs. And then in the back here, we have the spinous processes. And then we have the facet joints, which are where one bone meets another bone. So I'm just going to make that green right there. And that's really what two segments of the spine look like here. Okay? Now, just like the low back, these are kind of the coffee mugs that I was talking about in the low back, right? If you picture that, this is the mug facing the front of the body, and these are the handles facing the back of the body here. And where one mug meets another mug is where the disc is. Where one handle meets another handle is where the facet joint is. And those are kind of funky looking coffee mugs stacked on top of each other. Now, what we can't see in the x-ray, and what we can see sometimes in the MRI, are what are called the ligaments. So the ligaments, and I'll make those purple. The ligaments are what some describe as the duct tape that connects bone to bone. And there's ligaments all over the place. So we have ligaments in between the spinous processes. Those are called the interspinous ligaments. We have the ligaments that border the top of the spinous processes, which are called the supraspinous ligaments. We have ligament capsules that surround the facet joints. And we have ligaments that border the front of the vertebral bodies and the back of the vertebral bodies as well. Okay? And these are strong structures that keep all of the bones, adhered to each other, for lack of better words. Now, if these were in fact duct tape, well, then we wouldn't be able to move our necks, right? So, as I mentioned in the lumbar lectures, the low back lectures as well, the ligaments in actuality are like those thick rubber bands that surround broccoli in the grocery store. And I want to give a quick shout out to my patient Susan, who actually brought me some wonderful rubber bands that actually conveniently actually say broccoli on them. So thank you, Susan, for sharing this. But these are the rubber bands that I'm talking about, right? They're strong, they're supportive, but there's a little bit of a stretch to them. Well, that's what our ligaments are actually like throughout our body, connecting bone to bone. Now, there are a lot of conditions where those ligaments can get irritated, and we'll go over those in future talks. But just to talk about it briefly, there's a lot of folks that have hypermobility or looseness of the ligaments throughout their body, and that can predispose to various injuries or conditions, even things along the lines of issues with the neck. We can injure our ligaments of our neck when we have things like whiplash injuries. When we get rear-ended by a car, the ligaments can get stretched or injured. That's oftentimes implied with injuries specifically to things like the facet joints, where the capsule that surrounds the facet joint gets sprained or torn, and that the facet joint becomes a pain generator. We get imaging of the neck, and there's no arthritis, no things that we can see in that area. But when you do nerve blocks to the facet joints or you do treatments to the facet joints, patients get significant improvement. And the theory is that that's one of the areas where we can get a sprain or injury to the ligaments with a whiplash injury. And there are other areas as well, but that's one of the most common ones. So going back to what we were discussing, we've got the bones, we've got the discs in between, we've got the facet joints, we've got the spinous process, and then we got all these purple ligaments surrounding all of these things. Now, finally, again, what's not visible in an X-ray are your muscles. And there are a slew of muscles in the spine. There are little muscles that connect or in between your spinous processes. There are muscles that are longer, that cover more than one segment at a time, which are all called collectively the paraspinal muscles. And then you have larger muscles that actually go all the way from the base of the skull all the way down to your shoulders and all the way down to your upper back. These are called trapezii or trapezius muscles or traps. Okay. Back at the base of the skull, in the back of the skull and the top of the spine, the cervical spine, there are a bunch of muscles in this area as well. Collectively, these are referred to as the suboccipital muscles, but there's actually a slew of muscles in the back of the skull that are in charge of various different movements that we have up there. And it can also be a source of potential issues as well. Oh, on the ligament note, I forgot one important ligament that goes all the way up to the top of the skull as well. It's actually a continuation of the supraspinous ligament, which is also, by the way, a continuation of the interspinous ligament, which, by the way, is a continuation of part of the facet capsules, as well as the ligamentum flavum, which is the thick ligament that borders the back of the spinal canal. That all towards the superficial aspect. As the neck goes towards the skull, this actually fans out and becomes what's called the ligamentum nuchae. And that's this kind of thick fan of a ligament in the midline of our neck that goes all the way up to the skull, an important stabilizer of our neck, particularly in flexion. What else? What are we missing? Oh, the nerves. We can't forget the nerves. So, I mentioned all of these structures here, but where's the spinal canal, actually? The spinal canal is over here, but in between the facet joints on either side. So these facet joints that we've shown and these bones that we've shown over here, these are on either side of our neck. And in between those is where our spinal canal sits. And that's what contains the spinal cord And then from this spinal cord come nerves that exit between the facet joints and the discs. And then these nerves actually go down the arms in different directions. That's my really, really rough drawing of what ends up being what's called the brachial plexus, which is when all of these nerves come out of the neck and they come together and they travel underneath or between the muscles of the scalenes, the middle and anterior scalenes here, underneath the clavicle or collarbone, underneath our pectoralis minor muscle, and then through our armpit to go down the arm in different directions. And that, as simple as that drawing is a rough representation of what the anatomy looks like. Beautiful, beautiful, beautiful. So you can see how the x-ray shows a lot of stuff, but there's a lot of stuff that the x-rays do not show. So if you have neck pain, and x-rays might be one of the first things that we get when we get neck pain, you know, or either a primary care doc will order them or a chiropractor will order them. And these are things that do show stuff. There's you could see arthritis, you could see if there's movement of the vertebral bodies, you can see if there's some subluxation or different positioning, but there's a lot of stuff that you can't see, namely the discs. You can't see the nerves, you can't see the spinal canals, you can certainly not see any cartilage structures, although some people claim that you can see cartilage in x-rays. That is a lie. And you can't see the ligament structures. There's a lot that you can't see. That's where things like MRI comes into play. Diagnostic ultrasound could be used with a limited scope for some different structures in the neck. And then honestly, a physical examination can be really, really important at determining what are the different things that are going on. But I'm going to dig a little bit more into the neck anatomy because I do think it's important for us to talk some more and understand some of the different spaces, some of the different areas. So I'm actually going to zoom in my picture again and look at this model here. This is a cross-section of the cervical spine. I'm going to try to align this here. You can see from this view, this is looking at just one segment of the vertebral body or the bone. Okay, so I'm looking at this from the side view at this point, and now we're going to lay down on your back and talk about the different components of the neck. Okay, so I'm going to zoom this in. Whoa, too much. And now we're going to look at the anatomy of just one cross section of the neck. Obviously this is very, very zoomed in, but I think this is a really cool representation where you get to view the different parts of the anatomy. So just so I'm crystal clear, this is looking at a cross section cut like this. If you're laying down on your back, your head is past the screen and your feet are towards you. This is the front of your body over here. This is the back of your body. This is your right side. This is your left side. And when we're looking here, this is the spinous process, the nubbin that we feel on the back of our neck. Over here is where the disc sits. Right? This is where the disc, the nice cushion of the neck, sits between the bones. Over here on either side are the facet joints, or the facets that come together and form the joint. Technically, those joints are called the Z joints or zygapophyseal joints. Colloquially, they're called the facet joints because these are the facets. In between the disc and the facet is where the nerves exit. Okay. These are the nerves that exit out of the neck and go down the arms in different distributions. And the nerves come from the central canal, which contains the spinal cord. Here you can see the nerve is covered by a sheath. And you can see that on this side, when you remove the sheath, the nerve is actually contains multiple fibers that come directly from the spinal cord. As the nerves exit out of the neck, they're right next to this guy, which is called the vertebral artery. Very important structure that carries blood to the brain. And this is one of the reasons why doing injections in the neck need to be done with image guidance to make sure that we're not hitting or damaging this artery, because that can cause a stroke. This artery is also one of the reasons why we have to be careful about manual therapy or manual manipulation of the neck, because especially sudden thrusting, cracking, high velocity maneuvers have been reported to cause dissection or injury or tearing of this vertebral artery, and therefore causing stroke. So we have to be careful about this. That's why, although I've been trained in osteopathic manipulation, and I do some level of manual therapy, including of the neck, I reserve those high velocity techniques for very, very specific situations. And even then, we have to be very, very careful and very specific. We can't just whip the neck around. Now, you see the spinal cord here. There's a space that surrounds the spinal cord that contains cerebrospinal fluid. And then there's a space beyond that that actually contains yellow fat and blue veins, and that space is called the epidural space. And you can see that surrounds the space that surrounds the spinal cord, and that space also surrounds the nerves as the nerves exit. This is the space where epidural injections are done. And there's specific techniques for getting into that epidural space outside of the scope of today's talk. You can also see that that space is right next to the space of the cerebrospinal fluid. So again, these injections need to be done with image guidance in the hands of a skilled injectionist. And that type of physician needs to be very careful, because we don't want to inject into the cerebrospinal space. That causes a slew of issues, including potentially things like spinal headaches. Oh my gosh, I just noticed that my screen was moving there. Hope that wasn't gone for too long. What else? This blue line that we see right here, bordering the back of the epidural space, that's where we have the ligamentum flavum, which is a thick ligament that borders the back of the spinal canal and travels in between the different bones. And that's a thick ligament that we need to pass through in order to get into the epidural space for injection. That's also a thick ligament that, when there is loosening over time, that ligament can actually kink down and actually press onto the spinal canal, and even press onto the nerves as they are exiting. And then finally, you can see how arthritis of these facet joints, if these bones are actually getting larger, can actually narrow the space where the nerve's traveling. Or if the disc is bulging from here, can press on the spinal cord or press on the nerves as well. These are the ways that the most common irritation or injuries to the neck can occur. I thought it was a pretty cool model. Found it on eBay, I don't remember where. But really cool model to show, the different spaces that surround the neck there. And that's really the gist of the main anatomy of the neck. There's a lot more that goes into it. There is a lot that goes into the soft tissue structures like the ligaments. There's a lot that goes into the muscular structures, and quite frankly, the muscles throughout the neck region are topic for another discussion, because that in itself I could talk about for hours on end. So I'll save that for a future date, but definitely something important that we'll discuss. Very common cause of irritation or injury in the neck. And then there are really major important things that we'll discuss at a future date, including things like the upper cervical spine and why that area is unique compared to the rest of the cervical spine, and how that area is important because that's the area that connects with your skull. And very common injuries that we can have occur there that could then predispose to a slew of other symptoms, and oftentimes, quite frankly, not managed correctly. So we'll go through those at a future date as well. But I hope that made sense as far as kind of a general overview of neck anatomy. If you have any specific questions about neck anatomy, then please drop me a comment, drop me a DM, or drop me an email at info@fxregencenter.com. When I answer some of the comments from today, Danny said that's a very interesting description of the neck, and then she also said, where is the C2 and its involvement of the neck? C2, so I mentioned before that cervical spine, first of all, thank you. I'm hoping that this is beneficial for you overall, but the cervical spine is comprised. Sorry, it looks like we got disconnected there for a second. What I was saying was that C1 is the vertebral segment that's in charge of holding up the skull. And then C2 is one of the most important vertebral segments for rotation. That C1-2 joint is one of the most important areas for rotation. And C0 is actually what's considered the bottom of the skull itself. And the C0, C1, C2 complex is its whole different set of anatomy compared to C3 and below. So I'll have a specific talk to discuss that C0, C1, C2 region more in depth. So stay tuned for the future. But that C2 and C1 region ends up being really, really important. Commonly injured area when it comes to things like whiplash injuries, commonly involved for patients that have hypermobility, EDS or Ehlers-Danlos syndrome, or various other conditions. And irritation or injury of the C2 region can cause various symptoms, including headaches, dizziness, fogginess, even symptoms into the face or the jaw, and certainly neck pain itself. But definitely something that we're going to have to go in depth about on a different date. Heather Lee said that she wakes up with pain and stiffness in the neck in the morning. Stiffness in general, first of all, I'm sorry to hear, but stiffness in general is oftentimes associated with your plain old osteoarthritis or your wear and tear. And this is stiffness when we talk about any joint, and the neck is no different. When we start to develop some gradual degenerative changes, it takes us a little bit more to get moving in some of these joints, and that's oftentimes interpreted as stiffness. The other things that can cause stiffness in the neck are when the muscles are tight throughout the area. And as I mentioned, the muscles are kind of a different topic as well that I'll go into more in depth later, but there's a lot of different things that can cause muscles to be tight, so that's another thing that can cause stiffness in the neck as well. And then Ara mentioned, I wake up with pain in my wrists, sometimes the left side, most frequently on the right side. I feel something compressed in between my neck and my shoulders. So that symptoms down into the wrist areas, or even symptoms down into the fingers, symptoms to the forearms or the upper arm, can commonly be associated with nerve irritation in the neck. And nerve irritation in the neck can commonly cause symptoms into the area between the neck and the shoulder. There are other things that can cause symptoms in this region as well as symptoms down into the wrists or the hands. And that's even those muscles freaking out in these areas themselves. If those muscles are freaking out, they can refer pain down the arms also. But when these muscles are freaking out, we always have to take a step back and ask why those muscles are freaking out. And again, oftentimes that's related to nerve irritation in the neck, but it could also be related to the facet joints, the ligaments. Various different structures can cause the muscles to freak out. The way I describe muscles in general is that they're the great reactors. They react to everything. And God bless them, they're trying to do their jobs most of the time, but when they do tighten up, a lot of things can be associated with that, including pinching or compressing symptoms, as well as symptoms down into the arms. But lot to discuss as far as what causes what when it comes to the neck. Today, really, our focus was the anatomy. But in the future, for the next few weeks, we're going to be talking about several different topics. We'll talk about neck arthritis. We'll talk about pinched nerves in the neck. We'll talk about ligament injuries. We'll talk about muscle injuries. We'll talk about the upper cervical region. So stay tuned. I have a feeling we're going to be talking about the neck for the next couple months, not just a month. But stay tuned every Friday, 2 p.m. Pacific. Give or take, might be a few minutes late. And again, if you do have specific questions or things that you want me to address, hit us up. Hope you had a great week, and hoping that you have a great weekend. I'll see you guys next time.